I'm sitting in triage. I remember it was like not a busy day. And those are always the most terrifying because you're just like,
what's going to happen?
yeah, you're like, and this woman comes like frantically running in. So I open the door and she just plops this little kid into my hands. So I run this kid back to the trauma room. We unravel it, and their entire foot was ran over by a lawnmower. And I just was like, I was in shock.
Hey guys, welcome to Nurse Talk, the podcast where we talk all things nursing. I'm your host, Mia, and today we have Ashley.
Hi.
Thank you so much for being here today.
Oh, yeah. Thank you for having me.
So before you became a nurse, I always like to ask what you did beforehand, what careers you had or jobs you had.
So before I went into nursing, I actually I was in like the food industry. So my very first job was working at a sub shop, where it was actually funny. They had all the females do all of like the subs, like chicken, salads, burgers, all that stuff. And the guys only did pizza.
Nice.
They said that it was because females could multitask, which I later learned, you know.
Oh, yeah, for sure.
In high school, I was just like, this is so unfair. Like, I'm doing all the work over here.
No, it's that they literally couldn't do it.
Right.
No, do you feel like that experience shaped nursing or helped you in the journey, like, of trying to become a nurse?
I do. I then later became a server. I worked at a couple restaurants as a server, and I feel like that had a similar feel going into nursing, because you're still serving people, you know, in some way. So it's kind of similar, you know, especially when you're running and bringing waters all the time. It kind of felt the same as when I was a server.
Oh, 100%.
You know, every room needs a water right now. It's like, okay.
Yeah, it's like glorified waitressing sometimes.
It is, yeah. And I actually worked at a job where I was a patient care tech, right before I went into nursing school. And I had a boss who looked for people who had worked at Chick-fil-A because he said he knew. He's like, I know they're good workers. They're used to like a busy environment. And, you know, even, you know, they have such a good like mentality. They're positive. And even if it's like busy, they're still just like, you know, my pleasure.
Yeah.
Like, and I was like, that's so smart. So smart.
They're very good at customer service. I think another thing that maybe waitressing in the food industry gets you ready for is honestly the personalities as well of just angry people, happy people, people that are hard to speak to, that you kind of have to drag it out of them. I think those experiences certainly help you being a nurse. So what would you say ultimately like led you to become a nurse?
I would say I was in a car accident when I was 16, and I ended up fracturing my C4 and my C5. And it was in the middle of like a blizzard in April, or no, the end of March up north. So it was kind of like unexpected weather. And I was a trauma, like directly. I won myself a winning ticket to the ICU.
Nice.
I think I surpassed the ER basically because they were so full. I don't even think they really had like room.
Oh, wow.
And it was a wild experience. I remember on the way to the hospital, there was another ambulance coming to get, I don't remember if it was the driver of the other car or my friend that was in the accident with us. But that ambulance like wrecked off the road because it was that bad. Yeah. It was,
Oh, wow.
It was so wild of a time. And I just will never forget like my experience in the hospital. Like seeing every time I like wake up a little bit, I would see the screens that like were red, like, you know, I'm being wheeled around the hospital in the stretcher, and like I'm just seeing these like red screens. It was like high acuity. But so being 16, it was very, very traumatic. And from that whole experience, I only remembered my nurses, you know, I was such a young person. So going through something like that was like really difficult. So them being there to kind of help me and guide me, you know, was inspiring.
That's awesome. I think a lot of people go towards nursing because either they, had an incident or got sick themselves or watched a family member get sick. And it's like all of a sudden you're pulled or like moved to help others in that way. So I wanted to ask, what drew you to cardiology?
So I actually feel like I didn't have a draw to it, but until I was in it, and then I loved it. So I was a patient care technician on the floor, and so it was a really easy transition right into nursing. I already knew the nurses, I knew where all the supplies was, and I already kind of had a grasp of what the floor was like patient-wise. But then I ended up loving it. After you got experience on the floor, you then were able to take open heart patients, but they had to be after like post-op day 1. And that was my favorite. Like I loved it. You got to really like get to know them. They were usually there for a couple days, but getting them up every couple hours, you always had to have them in the chair for their meals. They always have their big heart pillows and they're walking around, but it was a cool experience to always see them like progress after their surgeries, like such a big surgery. And I think I also really enjoyed that because you knew the cardiothoracic surgeons, so you knew what they liked, you knew their expectations, and that almost made your job so much easier. There was really no surprises. You were like, I mean, occasionally, if something goes wrong with one of their patients, they're not going to be happy. It's not that it's your fault, but and they can be, I understand it's like a very high stress job, but I liked that you just kind of knew like what they wanted, versus when you work on like med surg and you have 10 hospitalists, you don't know what they expect or what they want, They like need to come do a bedside procedure. You're like, how can I help you?
Like, what do you need? I don't know.
I'm like, so I really liked that. And then, we did so many different procedures and recovering patients from different procedures. So it was kind of, you had, the open heart surgeries, which was a little bit more intense, but then we also had just like our quick cardiac catheterizations where it was like in and out in one day. So it was kind of like the best of both worlds.
Yeah.
So I really enjoyed it there.
That sounds rewarding, seeing like post-op day 1 or day 2 and then watching them progress and essentially walk out. That'd be amazing. Wow.
Especially patients that, or they came in multiple times for multiple catheterizations or ablations and then it was like their big day, they were then coming in for an open heart, but you already knew them, from, their past experiences. So it was kind of cool. You did get to see patients like you kind of got to know in that sense.
Yeah, I would love that.
Yeah.
I like continuity of care. And like being able to come in the next day and you still have those same patients. It's a little heartwarming when you get to know them.
Yeah. In that environment, it is. It's really nice. And then like they trust you and, and then you're not even talking about nursing or their procedures anymore. By day 2, you're talking about your family and then they're asking where you're from and, you're getting into like the nitty gritty about who you are. So, yeah.
So looking back on the early days from when you transitioned from PCT to RN on the cardiology unit, what would you say was probably one of the most challenging aspects for you?
I would say probably that since I already worked there, I think there was a little bit more expectation immediately.
Yeah.
But it's a big role transition.
Oh, yeah.
So it's like, I don't know anything. You know what I mean? Like, I know how to get into the supply room. Like, I know how to clock in and out.
Yeah.
Like I know the minor details. But overall, it was like, I don't know this job. Like I don't know how to be a nurse. I watched you guys, but... and so then it was kind of like, I did feel like there was a little bit more expectation at first until it was like, oh yeah, like she's new.
Yeah.
She's not new to us, but she's new to this. So that was probably the most difficult, was getting used to like, hey, I'm not a nurse. I haven't been a nurse before,
Give me a break.
Yeah.
So looking back, do you have any memories or anything that kind of stands out to you on the cardiology unit?
A couple good, a couple bad. I remember my very first code was actually like being a nurse was on my very last day on that unit. Yeah, I was like, what a bang. Like
Bye.
going out, I just got a patient back from PACU. I could just tell, like, something seemed a little off. Like, I couldn't even wake her up to do a full assessment. And, we had her on the monitor. Sure enough, within probably like 30 minutes of her being on the unit, it was, code blue. And I was like, oh my gosh.
Back to the OR.
Yeah. I was like, this isn't good.
Yeah.
But, all went well after that, I remember. But yeah, that was a not so good moment.
Was that your first time doing CPR?
No, my first time doing CPR was actually when I was a PCT. Yeah, I was walking a patient to the bathroom and they refused to listen to me. I was like, I'm pretty sure he just had open heart surgery.
Oh, nice.
And I was walking with him to the bathroom. This is when I worked night shift, and he refused to like walk. It was a sprint to the bathroom.
Nice.
And I was right behind him, but larger man, there's not much I'm going to be able to do in this situation. And head first into the bathroom floor. And I was like, first I just yelled like code fall because I was expecting that. But then there was no movement and I just like saw blood like rushing. And I was like, all right, we have a bigger problem. Yeah, this isn't good. Oh my gosh, it was bad. It was all in the bathroom. He's a big guy, so we have like no space.
You're like essentially squatting over him trying to do.
Yeah, like only two of us could fit in the bathroom. Like over, I was like, that was a nightmare. So that was probably my very first time.
I would prefer to do CPR as a PCT than a nurse, though.
Yeah,
because it's like, this is all I can do. I'm just going to stick to this job here, and you guys figure out everything else. With being a nurse, you have to take on the other roles.
Right.
Because anyone really essentially can do CPR.
Right. Yeah. And it was like, it was something kind of always not designated, but, EMTs and the techs, like it's kind of like, yeah, you do that.
We're pulling epi, like we need back here,
right, yeah. Someone's got to document and all that. So yeah, that was quite a time.
So after cardiology, you transitioned to emergency trauma. Why did you make that change?
I knew that I always had that adrenaline rush. I don't know if it was from my personal experience of being in a trauma, but I always felt a draw to when I'm hearing over the overhead, like code blue, room, blah, blah, blah. And I'm like hopeful that it's my unit. I always was telling people like, I think something's wrong with me. Like I shouldn't be hoping for this. But in that aspect, I was like, I just know where I need to be.
It's crazy because we need nurses like that because I'm the opposite. I'm like, I'm running.
Please,
I won't ever run away, but I'm like praying, please, not my patient, not my unit. Let's just have a good day today.
Right. Yeah. See, to me, I just, and I think before I transitioned to the ER, like I was just always hopeful, like it would be totally fine. Like I'm okay with it being my patient, my unit, like I'm ready. Let's do this. And so, yeah, I just felt that draw to like the chaos.
You wanted some action.
I did, yeah. And I did. I really tried to pursue the ICU because that was like the next place where a lot of our nurses went, was our CVICU in that hospital because we already knew the cardiothoracic surgeons. Like we would get all those post-op patients mostly. So that was kind of like the next stepping ground. So I was like adamant, like I'm supposed to be doing this and going to the ICU. And I had shadowed, I think, all of our ICUs, and because I just was like, it has to be, you know. And I think at the time I knew I wanted adrenaline, but I think maybe I was looking into the ER, but I don't know if there just like wasn't any positions open or what. But yeah, so I was really, really pushing myself to be in the ICU, and it wasn't, I think it was on purpose, you know, that my days, because I know there are chaotic days there. There's crazy days there.
Oh, yeah.
But the days I was there we're not. And I was like, I can't.
Boring. No.
Yeah, I was like, I need more.
Yeah.
Like, this isn't enough adrenaline for me. And so I just, I kept trying to force it. And that's was like my thing in my mind was like, why am I forcing something,
Yeah.
And then it just like unraveled perfectly and I ended up in the ER.
So overall, would you say that you enjoyed your experience in the ER?
Oh, yeah. I loved my experience in the ER. Yeah. I had a really, really good first ER job. I will say that was one of the jobs that I was working there, and I would tell people like, if I don't leave this job, I would just stay forever. And it's one of those things where you're just like, you have to know like when you need to like, I was too new. I was like, I'm still too new in this to like,
This feels too good to be true. I love this so much.
Right. I'm like, I need to grow. I need to like move on and like find more. And so I just was too comfortable, almost like getting too comfortable.
That's such a good way to look at it, because I feel like change. I've met so many nurses that even if they're on a horrible unit, they don't want to make the change because they're like, it's horrible, but I know what it is and I know what I'm getting into and I'm okay with it. So it's great that you had that insight of like, okay, I love this and I've seen what I need to see and it's time to move on and keep growing.
Yeah, I did. I loved it. I felt like, I maybe could have, if I would have stayed, I really say like, I don't know if I ever would have left. That was what was hard. But I think I left at a good time. I got a lot of experience there. It was a level 2 trauma center, but we didn't have a level 1 trauma nearby. So
Essentially.
right. And there was another big hospital. So at that point, they were a level 2 as well. So at that point, it just was who was closer in basically what the trauma was, if we got it or they got it. So I had a lot of good experience there and a really, really good team to work with.
So being in the ED, you must have seen a lot of things. Is there any moments you'd like to share?
Yeah, honestly, there is a lot. But I will never forget, this was a time when I realized like pediatrics was not really for me. I'm sitting in triage. I remember it was like not a busy day. And those are always the most terrifying because you're just like,
What's going to happen?
yeah, you're like, what is coming? What's coming my way? I'm in triage, like just sitting there patiently waiting, like nothing's going on. And this woman comes like frantically running in and like banging on the glass, which is very typical. And so I open the door and she just plops this little kid into my hands. And at first, like from looking at the kid, I can't tell what's wrong. They're just screaming, crying. She's frantic, not even able to really speak. So all I could see was like a towel wrapped over like the leg down. So I knew, okay, that's, where the issue is. So I run this kid back to the trauma room. We unravel it and their entire foot was ran over by a lawnmower. And I just was like, I was in shock, and I've seen so much, so much, even at that point. And I just was like, I really hadn't dealt too much with like children. We did get pediatric traumas. And that was just probably the worst part of the job for me was because I just couldn't handle it.
Because they're so innocent and then they're coming in and did his foot look like it went through a meat grinder? Or like what did it look like?
Kind of like a lot of the toes were not attached. Yeah. So, but that obviously was like, we didn't have a children's hospital there. So that was like a transfer out.
Yeah.
But that took all day. Like I'll never forget like the stress of that whole situation. And I just was like, I could not imagine being the mom. I was in triage, so I did not have to be the trauma nurse for that situation. I just helped in the beginning. But yeah, it's just that really drew me from pediatrics. I just was like, I can't, we always talk about how, family can be really difficult in nursing. And that I was like, I completely understand. Because if I was that mom, oh my gosh, I'd be losing my mind.
I wouldn't be able to form a sentence either.
Yeah. Yeah. And the mom wasn't there. We didn't have the right birthday. Or I remember like for like an hour, we didn't even have the right child's name.
Oh, goodness.
It was just like one of those situations that's like nothing is going.
After days like that, do you ever end up like not being able to sleep because your adrenaline was just so high all day that you get in your bed and you're like, like I can't fall asleep right now.
So I actually think I sleep harder because I'm like, my adrenaline was
Exhausted.
so high that the moment my heart rate like reaches 50, I'm like,
Really, I
out.
have the
Yeah.
opposite. If something really stressful happens, I'll lay in my bed like I can't come down from the adrenaline rush.
Oh gosh. Yeah, that's hard.
Even though you're like, oh my God, my heart rate and blood pressure is probably through the roof all day. Like I'm exhausted, but like
Right.
I'm just like laying there like, oh my God, like what just happened?
Oh,
My
yeah.
gosh.
I think especially if I process it, usually I will process things at work because we don't have a lot of time to.
Yeah.
So I'm like processing while it's happening and then the drive home. So usually once I get home, I'm just like, it's just like, oh my gosh. And like I feel a sense of like my blood pressure like lowering to the ground basically.
Well,
And
that's
then I
good.
just pass out.
That
Yeah.
probably means you have a good understanding of how to separate.
I would say I do. I've really not often taken things home from work that were patient related, I would say. Or maybe I've only been a couple times, in my 6 years of nursing that I did that, which is pretty good because it's a lot mentally.
I think it's so hard to learn how to do that. At least for me, like the first 2 years, I had no ability to separate. If something horrible happened to a patient or with a patient or anything like that, I took it home. And it was just, I couldn't separate. So I think that's probably why I struggled so much in the beginning, is just the emotional aspect. You know?
Right. Yeah. I will say I always talk to someone usually, like whenever I'm leaving work, I call my mom or my boyfriend. And, bless both of them. They
Oh,
just
yeah.
listen to me and it really helps me. Like
Oh,
before
that's
I'm
good.
home, I've already like had a whole, my boyfriend would be like, I'm going to see you in 30 minutes. I'm like, I have to
No,
talk
I have
about
to
this
tell you right now.
now. Yeah. Like I
Yeah.
want it over with before I get in the door.
Yeah,
So
my mom is a nurse, so oftentimes I would call her. And I will say, now that you bring that up, there probably was a huge difference in the way I felt after talking to my mom about my day. Because when I talked to my husband about it, he was very open ears and very like, oh, I'm sorry that happened or whatever. But like, I know that like 10 minutes into my story, he has no idea what I'm saying. He's like, I lost you at like, because if you're really telling a story, your verbiage, you're just going to use
Right.
the verbiage. And he's like, I don't know what happened. Like,
right. Like I lost you.
yeah. So I guess it is good hindsight to either have a friend or a family member who's a nurse that you can just like spew it out before you get home.
Yeah, I agree. That has been honestly so helpful. Like my whole nursing career is just usually I call my mom first. She doesn't answer, then I call my boyfriend.
It's like they look at their phone like, oh, it's the daily call. Okay. Just put her on speaker. No.
She's getting off work.
That's funny.
Yeah. But yeah, I've seen a lot, especially in the ER. And I think your adrenaline all day, like there would be days where so much happened that I would have so much on my mind when I got home. I couldn't even like explain it,
Yes.
like, and I think after that started happening all the time while working in the ER, I just got really used to that feeling of like, oh, just another day, like when someone's like, how's it going? In the beginning, I would be like, this, and this.
Yes.
And then like a couple months in, I was like, just the typical,
Yeah, I remember being sad when I got to that point where I no longer had the energy to explain it.
Yes.
Because I'm like, even if I explain every detail, you won't, unless you can see it with your own eyes of like this patient screaming because they just got the worst news of their life, and like then walking into a room and having to congratulate the other and being happy and having to do this like emotional, just up and down roller coaster.
Yes.
Even if I would have to take you for you to understand.
Right.
We'd have to have like a spouse gets to come to work day for you to even grasp what I'm trying to say. So I got to a point where I was like, I don't want to talk about it.
Right. Yeah.
And that was also sad to me, where I like just lost that, urge to even explain it.
Yeah.
I think a lot of nurses get to that point where they're like, oh, it's just another day. Crazy.
Right. Like we're always like, yeah, it's just busy. It's every day. I feel like you almost start talking more about when you have a good day.
Yeah.
You're like, oh, finally, like I went to work. I just like had my patients, like it was good and
Yeah.
all is well.
Yeah, it's going good. Bye. No. What about you? No. Do you have any other stories you'd like to share?
Another story I do have from my time in the ER was, one day, I don't remember where I was working in the department, but we had like two front glass doors and they're locked unless you like badge in. And this man runs up, he's banging on the door. I feel like that's how it always starts,
Which is like a movie scene because I've never worked in the ER and I didn't know that they just come banging on the window.
Oh, yeah, all the time. It's like the typical thing.
Yeah.
And you just never know what to expect because everyone reacts different to things. But so you kind of just always approach it the same, And so we're running out there, and this woman is on all fours in the back of a minivan trunk, and she's about to give birth.
Nice.
Yeah, in the back of the trunk. Honestly, it was probably one of the coolest things I've ever witnessed because it was seamless. Like after watching this, I would tell people like if I could have that be my birth story, I would.
In the back of a minivan?
Yeah, we were only out there for probably a couple minutes and baby was out. We had her in a stretcher. Baby was to her chest and it was beautiful. I remember I did ask her, I was like, you've done this before, haven't you?
Yeah.
She was like, yeah, this is my second. I was like, I could tell.
Oh my God. Can you imagine the first? That was your experience? No way.
Oh my gosh. But still, it was, I just knew. I was like, there's no way this could be her first. She just knew what to do.
Yeah.
All instincts kicked in. I was like, I'm a female, but I have no idea,
Yeah.
And I'm also not a labor and delivery nurse. So I just know, the basics of this.
Oh, of course.
And, but yeah, and it was crazy. So, and it was outside in our front parking lot, which is even crazier. At that point, it's like, do you even need to go inside?
Do you want us to charge you or do you just want to go home?
Right. How good are you feeling?
Yeah, well, honestly, I think you're right in terms of like, I would want my birth experience to be like that. Because if you think about it, her adrenaline must have been so high, like trying to get in the back of a minivan, trying to get to the hospital. You arrive, you're giving birth within like a few minutes. All these people are running towards you. Like, it's almost like, I don't even know if she even noticed her environment around her. She probably was so like primal and in the moment.
Yeah.
But I kind of imagine it being almost helpful that all this stuff is happening around you and you're just like, what is going on? And just
right.
Like
because it's not the normal environment.
Yeah,
so
the normal environment is so like everyone's staring at you and it's all on you, but this time everyone's running around.
Right.
People are like, grab this, whatever. So it's like almost like a nice distraction.
I was
from
gonna
the
say
pain.
that. Yeah. Like it probably is really distracting, like for you to look around and be like, I'm in the back of my minivan giving birth right now.
Yeah.
Like, no big deal.
Maybe some of that pain kind of was taken away, at least just from distraction.
Yeah, that's true.
I am curious to know if she was charged for like a birth because, you bring her in and she's postpartum at this point with her baby. And it's like, what did the hospital charge her for that?
Right. Because they didn't have to do anything. Like we didn't even do anything.
But if you think,
we just got, I think one of our EMTs caught the baby and then, wrapped it and we gave it right to her,
which is crazy because like
her.
But if you think about it, some moms, they'll have a full natural delivery, no medications, really no help. A doctor came in, caught the baby, and it's like $4,000,
right?
So I was just curious. It was just a random thought, like I wonder if they really charged that woman or if they just did like a nice little checkup charge and sent them on the way.
She probably was waiting it out. I've seen a lot that become more common where people are like waiting longer at home, not that they want to do like a full natural birth, but like labor at home and then go in.
Yeah.
Honestly, it's probably what she was doing, unless it just came earlier because it was her second. But it was sweet. It was beautiful. I don't work L&D or NICU, never have, but I've seen quite a few births.
Births are amazing to watch. They really are.
Yeah. And in the ER, I will say, luckily, I've always seen good ones. Like they've always been pretty good. I think it's been hard. The hospitals I've worked at were not children's hospitals. And one hospital I worked at where we had a birth, it happened in the middle of the night. And I remember like getting the baby transported was really complicated. And we had to sit there and take care of mom and baby for hours. And it was
You're like,
like,
well, what am I doing?
right. I'm like, anyone a baby nurse here? But like, we didn't have a NICU or an L&D or mother baby unit at that hospital. I was like, this is wild. It's like,
And you wouldn't think so, but babies are very different.
yeah, it is. But I remember at that time, the hospitals, the doctors were in good communication. Like our ER doctor with the doctor at the hospital that the baby was transferring to. And mom was going to transfer too, but of course we were waiting, baby was going to go first and then transfer mom. But yeah, that was crazy experiences. Crazy. ER, you just never, ever know. You can never guess what your day is going to be. And I think I've always liked that about it.
Do you think if you had to do bedside that you would go back to ER?
I do. I never say never. The stress, it can be high sometimes, but I think after like a good break, you kind of feel reset and you might almost like miss the adrenaline sometimes, but then you kind of can always remember the things that turned you away from it too. You're like, okay, yeah, but it wasn't all that great.
So after you did the emergency room, you did some traveling.
Yeah.
Would you like to tell me about your traveling experiences or like where you went and how you felt?
Yeah. The first place I went was Denver, Colorado.
What time of year did you go?
I went in July. Okay. Yeah, I went in July. I randomly took a travel assignment there. I was so excited. I really can't believe I just up and left by myself. Like I didn't have a single friend that lived in Colorado. I didn't know anyone, never been. So I was like, all right, we're just doing this. And my dad helped me move in. That was like fun, getting in a new spot and like exploring the town. And then I started work and I started my very first contract. I actually only was there for 3 days, which was really, really a difficult time because
you're new to it. You're like, oh my God, they're going to think I'm horrible. And should I do this? Like, do people do this? Or am I just...
Right. I was like, I feel like I've gotten a lot of experience, but I went there and I had I remember my very first shift was good. But my second shift was not so great. And when I first started, I asked other travelers there, I said how long do you give yourselves before you feel comfortable? I know I'm a new traveler, but there's no way that people just walk in a new hospital and are perfect on day one. There's no way.
Where's the bathroom?
Right. How do I get into the med room? What med system do you guys have? What pumps do you guys have?
Oh my God. Even the needles are different. Everything's different.
Everything, especially going from East Coast to West Coast.
Oh, wow. Yeah.
It's very different. There's a lot of differences, even just in IV catheters, And I remember I had such a sick patient and I was so nervous because I was I don't even know how to really document on this. Is my first time using Epic.
Oh, wow.
I felt like I didn't know how to document on it yet, but when you have your normal patients, you are able to learn kind of, but then you're thrown a really, really sick patient on your second day. I was frazzled.
Oh, and yeah, I would be too.
It was probably very, very obvious. And I remember another travel nurse came over to help me. And she had been working there for, I want to say a year. And she was because this was not a trauma center I was at. So I was also not that I was overqualified to work there, but I had been at a trauma center.
Yeah.
So I was like, okay, well, this will be better for my first assignment.
What unit were you on at this time?
So this was my first assignment in the ER.
ER, okay.
And so I was thinking, not a trauma center, great, you know, that'll kind of help me grow into this travel thing. And that was what I was looking for, was something that wasn't a trauma unit or trauma center, so I could kind of grasp the travel part to it. And another traveler came over, she's helping me with this sick patient, and she said, Ashley, I've worked here a year, and this is the sickest patient I've ever seen here. And I was like,
oh, yay, thanks.
I was like on my second day. I was like, oh my gosh. So I think that possibly made my mindset even more frazzled thinking that, because I was like, okay, like they don't even get these type of patients all the time,
And
you
they
know?
gave it to me on my second day.
Right. And I think when you are a traveler, there is that expectation that you just know everything and you can hold your own. But to me, in the ER, it's a lot more teamwork and team nursing, because you can't do everything at one time. You know, you get a sick patient in there, you know, it's like you can't run a code by yourself.
Yeah.
So how am I going to be able to, you know,
Stabilize a patient by myself.
right, like put them on a monitor, run all these drips, and, you know, do everything I need to do. I can't do it all by myself. So it was a very eye-opening experience. And in the beginning, it was so discouraging, because I remember after that, I fell under a microscope with this assignment, and I didn't like it. I was like, I just don't, you know, I don't feel comfortable here anymore. You know, it doesn't feel like I'm going to have like the team, you know, kind of environment. It just felt like, you're a traveler, here you go, figure it out yourself. So I only stayed at that assignment for 3 days. And so luckily, I do tell people, you know, having a good background in nursing is there for a reason, because when you travel within maybe a week or 2 weeks, I had another assignment, and that was amazing. You know, I was able to, then I went to a cardiac PCU. So then I was able to use that experience that I had and went there. So I ended up staying in Denver for about 6 months total.
That must have been so nice, though. Just like a
I
different
loved
environment.
it. Yeah. Once I was in the second assignment, I was thriving. I was like, I could actually see myself living here. I was like, I love it. I still say that. I'm like, you know, if it's not for Florida, I'm like, it would be Colorado.
Oh, yeah. I hear that people go for the winter and stay for the summer.
Yeah, I could see that. Yeah.
That's, at least when I went there, I've been there 2 or 3 times. And everyone says that. And it's because I always go for snow.
Right.
You know, because we don't have snow here.
Right.
So, yeah, I would go. And every time I go there, they're like, come in the summertime.
Yeah. Oh my gosh. It is. It's so perfect. Because we're so used to the humidity. There it's dry. And it like always felt good, like every day. You know, I remember running in the summer, and it really did not feel brutal the way it is here.
Oh, yeah. Or it's raining.
It's just so beautiful. Yeah.
Yeah.
Yeah. But
So after Colorado, where did you go?
after Colorado, I did take a couple of assignments in Florida, because I started dating my boyfriend, and I was trying to kind of go close to him sometimes, since we were doing long distance. So I did a couple assignments in Florida, and then my next like different state was Albuquerque. Yeah, I went to New Mexico.
Did you like it?
I did. It was not my favorite assignment, but I'm glad I went. It was like the kind of thing where I was like, you know, I'm just going to do this and go. There's something about the like out west to me, I guess. I don't know.
Just pulls you in.
Like this, it's like this draw. Like I grew up on the East Coast. I'm here, you know. So I'm like, something about going that way was just like a draw to me, and kind of just like dropping off face of the earth. I think it felt, like I'm
Yeah.
just gonna go be by myself, like go to the grocery store, no one knows me, kind of thing. So I loved the experience that I was given to go there. And I was there for 3 months. I worked in their level 1 trauma center, and I was in the ER on that assignment, which was pretty crazy.
Yeah.
That ER is like a wild, wild west ER.
Literally.
Yeah. That waiting room every day is like 85 people out there. Like by the end of the day, like nurses were actually assigned to the patients in the waiting room because they would be out there for so long. Yeah. Like that was an assignment. Yeah.
Oh, wow.
Yeah.
So you got a really good experience there.
Yeah. Yeah.
You must have seen a lot of things.
Oh, yes. It was busy. It was a busy ER, and they had a lot of holds. Like that was a big issue there, is that we were always holding patients, and it was really hard because being like a level 1 trauma center, we're getting people from Colorado, Arizona, and they're just stuck in the ER because no one's moving anywhere. It was, and it was a really big hospital too. I remember one day I actually floated to their PCU, and it was such a different vibe than the ER. The ER felt so, because there's just doors that are open to the outside world, and it just feels like it was nonstop every day, all day, like just in and out. But then I went to the PCU and I was like, wow, this is so nice up here.
Yeah.
I was like, it's so contained. Like you guys have really safe patient to nurse ratios here. Like, so the inside part of the hospital was like really, really nice, and it was good. The ER, it just was so busy. And I think it was also very travel heavy. Everyone was a traveler there. So
that must have added like a lag in
for
patient
sure.
care.
For sure. I think some of them stayed a while because of that, because they just knew it was like an easy way to stay somewhere. Like you can reassign. So some people stayed for a while, but it was nice being a traveler with a lot of travelers.
Yeah, because you didn't feel like you were hated out of
right.
Yeah,
and like the staff there, they just had to accept and like the travelers.
Thank you for the help.
We all were travelers.
Yeah.
So I can't even really remember. There was maybe like 8 staff members that I could think of.
Goodness.
Yeah, and it was a big ER.
It was probably because the ER was just so uncontrolled that they were like, I'm not doing this for a lot less pay.
Because I think everyone on the inside was staff. And then I think the ER, it literally felt like the ER was a different hospital compared to like.
That's so interesting. I wonder if that has to do with the resources that are like out in that community and the lack thereof.
Yeah.
How it kind of represents that community. And
I know it is. That was a hard place. And yeah, it was busy, but it was a good experience. And I was there actually. Have you ever heard of the balloon, like the hot air balloon fiesta?
No.
I think it's the only one in the United States, actually. It's like in October, and it was perfect that I was there for this.
Oh, yeah,
because
you got
it's
lucky.
Once a year, it's a week long, and it's like this hot air balloon festival, and you wake up at like 4 a.m, and you like just meet up with all your friends, and you walk, and it's like thousands of hot air balloons.
Wow, that must have been beautiful.
So cool. Yeah.
You take a lot of pictures?
Yeah, I
too.
did. Yeah.
I have like 20 pictures of just random balloons in the air.
Yeah.
It is so cool.
It was so fun. Like, what an experience. So I was so glad, because whenever I tell people I went there, that's usually the first thing they ask me. They're like, were you there for the festival? I was like, I actually was.
Oh, they're
like,
so proud of it.
So it was so worth it. I felt like if I had a bucket list for Albuquerque, I did it.
That's awesome.
That was great.
So from New Mexico, did you go anywhere after that?
I did. I I think I did a couple more assignments in Florida. I kind of always stemmed back at some point. Like I'd go far.
Okay, it's been too long. I need to come back.
Miss my boyfriend. Then I'm like, all right, I have to come back to Florida. And then I did an assignment in Nashville.
Ooh.
Yeah. Yeah. I think that was my last assignment before coming back to Florida. Yeah. So I went to Nashville for 3 months. And it was fun. I actually had a friend that was also travel nursing there. So we ended up living together for part of it. And we lived really close to Broadway, which was so fun because we just like were close to downtown. Yes. And yeah, I love travel nursing. Like I tell people whenever you feel like you don't know what to do, like if you're just so like you don't want to take another full-time job or, you know, you're so in this like scary feeling of like, you know, taking another job sounds daunting. I was talking to a friend recently about this actually, and I was just like pushing her. I was like, then just take a travel assignment in what you know.
Yeah.
I was like, you already know it. Give yourself 2 weeks there, you know, especially places that are travel friendly. I never went to another assignment where I felt unsafe, unwelcomed after that first one.
Oh, that's so good.
Yeah. So I tell people, I'm like, that is what I would recommend when you like don't know what to do, you know, because you just get to go like live somewhere, explore, but then it comes to an end and it goes by so fast, so fast. I think talking about it, I'm like clearly missing it right now.
Like, you look like you need to go somewhere.
Maybe
it was so great.
I just need a vacation.
Well, I guess you kind of sort of can treat it like a vacation if you have the ability to, you know, bring someone that you love, like your boyfriend, or
Yeah.
that would obviously be the best case scenario so that you're not, you know, missing home and that you can really, at least on your off days, really experience the area and just get to, and you're getting paid to do it. So, I mean,
right.
Yeah.
Yeah. So fun. Like if I was single, like a single girl in my young 20s as a nurse, and I have friends that were a nurse. Oh my gosh. Like I wish I could go back and convince like all of my friends in a group, like, let's go do this. Like
that sounds so fun.
Yeah. Doesn't it?
It does sound a lot of fun.
And you wouldn't even feel like you're really working because you just, I don't know.
It's like a group of friends, a new city, double or triple the pay.
Right.
What's so hard about that? I would go.
Yeah. I'm like, man, if only we could go back in time. But I'm glad I did it while I did it all.
Yeah, I was married before I became a nurse, and I was like, I can't leave them that long. I just can't do it.
Yeah, no, that would be so hard. I think, honestly, my boyfriend pushed me because we were already doing long distance. So it kind of was an easy adjustment because we were already far apart.
Yeah. So it's like, what's the difference really?
Yeah, there really wasn't one. And he really, really pushed me to travel. He's like, you'll regret not doing it, you know? And I'm so glad I did because I realized not how easy it is, but kind of. Like I know, you know, as long as I'm a nurse, I can always just drop and go take an assignment somewhere if I wanted to.
Absolutely.
And like, that's so fun, you know?
It is fun, especially if you can get an assignment that's on something you already know. Okay, just let me figure out how to chart, figure out where all the supplies are.
Yeah.
By like midday, I'll have most of it down, not charting, but you know, where everything is and everything. And then give yourself a day or two to kind of like, oh my God, this is a lot. Yeah. And then you'll probably really enjoy it after.
Yeah.
I'm glad you had a really good experience with that.
Yeah, me too.
Yeah.
I made a lot of good friends. That was also really cool. I kind of have picked up friends everywhere I've gone.
Which is so cool because if you ever want to go back, you can just be like, hey, want to visit her on, you know, this weekend, and you can go see like another town again. And
yeah, actually one of my friends, I made 2 really close friends in Denver, which was my first assignment. And I used Bumble BFF to make friends. And they were my 2 first friends there. And one of them, I was actually in her wedding.
Oh my God.
Yeah, so it was like crazy. Like people are like, "How do you know this person?" I'm like, "Bumble BFF." Like
That's amazing.
You should be over bachelor nights.
You should be on the Bumble BFF commercial. Like literally, like what more could they ask for? You were in her wedding.
I know. And now my other best friend from there, we have now been best friends for a couple years, and we just booked a big trip together for her 30th this year. So
that's amazing.
It's like so cool. You know?
That is really cool.
Yeah, it's awesome.
So after travel, did you come back and have that moment of like, what do I want to do now?
Yes.
Yeah, was that a difficult time to kind of navigate through?
Um, a little bit. I feel like I knew, well, for one, I needed to move near my boyfriend. I was
Yeah,
like,
you're
we're
like,
not
all
doing
right,
long
yeah.
distance anymore. We can't keep doing this. As much as I loved the traveling. So I knew that that was going to come with a move. But yeah, it does feel daunting when people are like, you're a nurse, you can do whatever you want. And it's like, but that's the thing, is what do I do then? Like,
Yeah.
and until you do it, you don't know what you like and what you don't like.
Exactly.
I'm like, okay, I've worked in a hospital setting, so that's kind of all I know. You know, I'm like, I don't know how it is outpatient world or clinic world or the OR even, you know? I'm
that sounds
like,
scary and daunting. I'm like, is that completely different? Like everything has to be so like precise for whatever
right, for a
doctor wants.
surgeon.
Yeah.
I'm like, it sounds cold, like dark, I don't
It
know.
sounds stale and like just like dry. I don't know. Like
But
everyone's
then I'm like
quiet.
intrigued by it too.
Because the hours sound nice.
Right. And I'm
Yeah.
like, your patients are sleeping the whole time. I'm like, okay.
Yeah.
So I don't know. It's like, what do you do? You know, I feel like it is the good thing of nursing. You can do so many different things.
I feel like it's a double-edged sword though, because you have so many options it's amazing because you can always pivot if you don't like what you're doing. But then
Yeah.
it's also a lot of work to start a new job. You have
Yeah.
to go through a whole, orientation. You know, you have to go through all of these interviews and get that job that you wanted and to realize you don't like it.
Right.
Because it's completely different than what you were doing prior. And you really have no way of knowing if, like you said, if
Yeah.
you're going to like it at all.
And I think I've like tried to go into things with the mentality of like finding what's important for me personally. You know, we all kind of like different things. Like some people, you know, they just care about having weekends off, or, you know, they absolutely don't want 12-hour shifts. Some people are like, I'm not working for anything under 35 an hour, you know?
Yeah.
So I think I've really had to just like go back and forth between like weighing what is the most important to me. And I think one thing I do prioritize is like flexibility. You know,
Yes.
I love that. And I think going from traveling, something I always said is going from travel nursing to a full-time job sounds daunting because I have so much freedom. I'm usually picking my schedule. It comes to an end after 13 weeks. I'm making good money.
Yes.
So then it's like, how can I go to like, I can't even picture it, like going to a Monday through Friday job.
No, I want one because it sounds better sometimes, certain aspects of it. No weekends, no holidays. And then I think about like, I can literally have like Thursday through Sunday off, but then my
Yeah.
schedule can be laid out to the point where I don't work again until that following,
Yeah.
Thursday. So then I'm
whole
working full time,
week.
but then I have a whole week off.
Right.
I don't know. It's really hard to
It is. And
make that change.
I love talking to other people who work. I think such a fun thing to do is talking with other nurses to see what they do, what they like about it. You know, because when I talk to someone who works on Monday through Friday, things that come into my head are like, when do you go get your nails done? Like, how can you go to Target when it's not busy? Because I'm like so used to doing these things on like a Tuesday morning.
Yeah, or like every time you have to do a doctor's appointment, do you have to take like PTO and like tell everyone you're not going to be at work?
Yeah, it's so true. It's like, how do you manage
function?
normal life? Yeah.
How do you have children that like, I guess half the time they're in school, maybe at the same time, that actually probably
I
sounds
actually
good.
think that's when people do typically like Monday through Fridays because it aligns with like a kid's schedule.
And you don't miss
better.
dinner time and, bath
Right,
time and all
and
that stuff. But
sports.
yeah.
Yeah.
But I can't imagine it now.
No.
Oh my God, no. That sounds horrible.
I know.
I think the most ideal like job for me at the moment would be something remote, like very administrative, but like still 12-hour shifts. And I don't even think they have many of those.
Yeah, I don't know.
Yeah, it is really weird how nursing, there's so many different avenues you can take and there's so many different lifestyles that you can live within the field.
Yeah.
Yeah.
It's so true. And that makes it, to me, harder to pick. Like, that's what you're saying. It's a double-edged sword. Like, it really is, because it's great. We can do so many things, but it's like, okay, well then tell me what I need to do.
Help me, I don't know.
Yeah, pick it for me.
Okay, so where are you at now? What are you doing now?
So right now I am doing mobile IV nursing. I just started about 2 months ago. So just kind of building clientele and, making people feel better with IVs. So it's been a good transition, really, really good transition outside of the hospital. Yeah.
So are you an independent contractor now?
Yes. Yeah. So I'm a
Okay.
1099. I work for a company, and I basically just, market and do social media to try and get clients. And then they'll book appointments through me. And yeah, it's been fun. It's different. Such a different nursing experience.
Again, going into the conversation we were just having, where it's like, you really can do so many different types of things.
Yeah.
Where it's like, you can go to the hospital, know exactly the amount of hours you're going to work, exactly what you're going to make. And then you can choose to make this entire transition where you're finding all your clients.
Yeah.
And
You're
kind of
like
doing your own thing.
you're like marketing, sales, business,
Everything.
nurse. And I'm like, okay, this is different. Like,
Yeah.
I've never done this stuff before.
What
So
would you say are like the main pros and cons of being an independent contractor? I know you just started, but
yeah, some pros, I would say the flexibility. You are your own boss, essentially. So you can kind of work when you want, but at the same time, that means you don't have to work and when you don't want to.
Yeah.
And that's also hard. I think there comes a little bit more discipline with that. So that is a pro. You don't really have like a cap on how much you can make, which is good. Most IV jobs we make commission based. Some pay hourly, but commission and then tips. So, which is nice because it's like the only nursing field you ever like get tips in, which is crazy because I almost feel like in a hospital, I deserve a tip at the end of my 12 hours.
I just wiped your butt 4 times.
Right.
And you were sitting in a diarrhea pool. I deserve a tip.
Yeah.
But now you go do one IV and you get a tip.
I'm like, it's so different, so different. And people are very, very thankful for IVs because it is a quick fix almost, you feel relief within an hour, sometimes while I'm there, people are like, oh my gosh, I already feel better. I'm like, great, that's awesome.
Yeah.
That's the purpose. Some cons, I would say getting clients for sure. That is hard, especially being a nursing degree. I have entered a new world of kind of sales and marketing, which I'm not used to. I'm used to everyone just going to the hospital and all my clients are there.
Yeah, you don't have to ask anyone to come. They're just there waiting for
Right.
you.
If anything, I tell them, no.
No, go home. No.
You can just go home. You're fine. But yeah, so it's like trying to get clientele. And some people, like, there is a good mix. Some people really don't like IV therapy, which is totally fine. And I always tell people, I'm like, it's not my job to convince you.
Yeah.
You need it. It is a luxury. You're sick, you don't feel good, hungover, or, I always say if you feel like you're coming down with something, but it's a luxury. It's not a necessity.
Absolutely.
So that can be a con is, I have had some clients that almost were seemingly not for it. And I'm like, wait,
why are we here?
You called me. I'm like, I don't want to have to convince you now that
Yeah.
I'm here that you need this. I love finding people who just are like-minded to me and they believe in it. They believe in more like holistic medicine and vitamins and supplements, versus going just medicine route, and so that's the clients I really feel like I mesh well with. And I can teach and explain what I do and they love it and it makes me feel confident. I don't want to have to convince someone, that they need something if it's not for them. I mean, it is a needle.
Yeah.
And I realized that. I'm like, just because I'm not scared of needles doesn't mean everyone else likes them. So,
Yeah.
But yeah, it's been a good transition out of the hospital though, because it's, like I said, so flexible. There's no cap on like how much you can make, which will in turn like make you try to work more and harder. But at the same time, you can go a whole week without having a client. And so it's like,
yeah, that would freak me out.
It's like the ups and downs.
Yeah.
You're like, oh my gosh, like how do I manage through this? But yeah, no, it's been really good so far.
I think that would be just so weird because it's such a learning curve, because I feel like 80% of your job is getting the people there and figuring out what they need and, who they are and kind of trying to figure out essentially what they need. However, the other 20% is actually the nursing part.
Yeah.
Like, okay, let me give you your IV and, just make sure you're not, taking any medications that would,
Right. Yeah. Going through like
literally that's history. Like 5 seconds.
Yeah. It's like, it's so different.
Yeah.
Like your nursing portion is like really
nothing
slimmed down to just the IV and giving them the fluids and vitamins they're looking for, And I think my favorite part is though, when I do get clients is I like to tell them if they don't, some are really educated in these vitamins, which has taken me time.
Yeah. You're like, wait a second, do you know more than me? No.
Right. Because I always think like going into nursing, we don't about vitamins.
No.
At all.
In pharmacy, it's like for like one like slide on the PowerPoint and they're like, hey, we got other things to talk about.
Here's your B complex, vitamin C, vitamin K. You know everything now. But yeah, so like when I first started, I was like, what are these? Like, I don't know some of these things. And I love clients that are like educated on them already. Sometimes like they teach me things, but they also will research to figure out what they need and like what they want. But I do like when people are like, they want my input. They're like, I'm having this problem or this. And then I kind of just give my recommendations. And I always start with, if it was me, this is what I would do, But yeah, so it has its pros, its cons. Still kind of getting in the flow of it. It's definitely a huge nursing learning curve. I would say like that's like the number one thing. I always get asked questions about being a mobile IV nurse, and it's, do I order my own supplies? And it's yes, we do. We have to order all our own stuff, but I like that because you can keep track of it. I couldn't imagine if someone else had
and I guess it cuts out that time period where you have to go and be like, oh, I need to drive to, the warehouse or, whatever, the office and grab my supplies to then go and then go to this location. When now it's like,
yeah, I get all my supplies shipped right to me, which is so convenient.
But then there is that scary overhead where you're like, you have to have enough supplies. Right. And then like, am I going to end up using these supplies? Like you're almost
because like, they expire. Yeah. Like we have, like our B12, our glutathione, those are like refrigerated. So those obviously expire quicker.
now it's taking space in your refrigerator.
I bought a cute little pink mini fridge. For just my vitamins.
So looking ahead, what kind of nursing do you foresee yourself getting into?
Oh, that's a really good question. Something I've always had an interest in, but I haven't really pursued much is aesthetics. I feel like it's booming right now. It is a poppin' industry. But I think I just have always had like a personal love for aesthetics. Started the Botox, the lip filler, and I love it. Like, I love everything about it. I love feeling good. Like, after I go, I feel great. Yeah. I love seeing before and afters of, like, what people can do. You're like an artist for, like, someone's face. So you kind of are just like, they say how they want to look, and you're just figuring it out.
Does that kind of scare you, though, because it is someone's face?
Yes, a little bit.
I think
Yeah.
about that. I'm like, oh my God, like if I do anything wrong, it's their face.
Yeah.
Yeah.
100%. But I do think with it, have you ever gotten any like
No.
aesthetic procedures? There is like a little bit always like of a healing time, but I think that's very normal.
Yeah.
But so there is like always a little bit of like a recovery time to it. So which is scary because like people will bruise and stuff
Yeah.
like
And you're
that.
like,
And it's
it won't look like that, I swear.
right. But I think I've seen just mainly in other people because of the stuff I get done. It's not immediate results really, except like with lip filler. But when I've seen like some results immediately, you know, like when I see people get filler like in their chin or their jaw, and it just like it creates like, oh my gosh, like such a beautiful look.
And when people like add in on their nose,
Yes.
I've seen that and I'm like, what a difference that makes. And they didn't have to like, undergo surgery and all of that. So
That's actually something I would love.
no,
Myself.
stop it. Your nose is perfect.
I know one time I had a patient, I remember she told me, she's like, you have like a little movie star nose. I was like, I've never been told that in my life.
You literally do. It's perfect.
I'm not big on anything except I love getting my Botox. It also helps with my migraines and then lip filler. But I've just always had, I don't know, it's just something I've always had a personal interest in. So I feel like it's something I would enjoy.
Yeah, I think that would relay if you like it personally. I think that would obviously really relay into like just your practice.
Right. I agree. And I feel like doing IV therapy is definitely something that's offered in a lot of med spas. And I'm also doing, you know, like IM injections and stuff like that. So getting really comfortable with needles, I feel is important.
Yeah,
so
absolutely.
It's kind of something I've already done and been doing is like getting comfortable, you know, using the needles and, you know, drawing up stuff. I mean, there's so much to like the anatomy and learning, but yeah.
I think it's such a competitive field that maybe that is kind of a way that you can kind of get your feet in there. And even in a shadowing aspect where you're just kind of seeing like, is this something I'd really like to do? Maybe that kind of situation where you're the IV nurse in that environment would not only get your feet in the door on a personal level with the staff to try and be like, I'm interested in this if you have an opening. But you can also, on your off time, just go in there and watch and
shadow.
Shadow, that might be a good way to get into it.
Yeah, I know it is. It's tough. And sometimes now it's just, I always tell myself, I'm like, sometimes it's not what you know anymore. It's about who you know, because
100%.
Nursing is so, it's funny because we're so short staffed, but in the hospitals, but there are so many nurses.
Oh,
you know? So it's like, where do we all go?
Cosmetics. I feel like cosmetics is so hard to get into because everyone wants to do it because it's not poop, pee, vomit. It's someone with money wants to come and make their lips look a little bit better. Like it's not
it's a luxury.
It's a luxury at the end of the day, and I think being a nurse in that scenario would also feel like a luxury, which is why everyone wants to do it, of course. And
so. I do think, here you obviously have to be, a mid-level or some sort to do injections. So I think that that's kind of where it makes it even harder because I feel like aesthetics here is a little bit more difficult to get into.
Yeah.
So, that's why I don't know. I just I keep open-minded about it. I'm like, even if I got OR experience, that's still good for plastic surgery and that sort of thing. So there's just so many different avenues to, kind of see if that is something, to go down that route. But it's definitely something I've always been interested in. It sounds crazy, but when I first started nursing, what I really felt was my dream job was actually to be a flight nurse practitioner. I used to tell people that all the time. I was like, oh my gosh, like it would be just so rewarding. I feel like I would know everything, if I was doing that job. Like I would be just a know-it-all.
Oh yeah. And there is no predicament that you wouldn't feel comfortable in after some time, of course.
Right.
Like
After
I can do
training.
anything.
Right. Like
Yeah.
you would be, I feel like that would be a very just rewarding job to have. But obviously, I used to say that prior to going into nursing.
Yeah.
So I've learned a lot more and realized how big responsibility that is.
Yeah.
And how hard it is to get there. So I don't know. I never say never because,
I feel like you're very spontaneous and like you're willing to try something new. So
mobile
honestly,
IV nurse today, tomorrow flight nurse. No, I'm just kidding.
I will very much keep track of your nursing career. I'm just be like, whoa, let's see what she's doing this month.
Right,
No.
right. Let's see what she's doing now. Yeah. But I was actually listening to, I don't know if it was a podcast or a video recently, but someone was talking about nursing and something they said that really, really resonated with me and how what you were just saying is how nursing is not linear.
Yeah.
And it's so true. I think we all go into it thinking, I'm going to do this for 40 years. And it's like, then you enter it and you're 1 year in and you're burnt out and you're like, I cannot do this for 40
yeah.
years. Like you have to move around, grow, and like find where you can be. And I feel like not a lot of places people start is at all where you're going to end.
Oh, for sure. And what was more surprising to me would be the nurses who were on that med surg unit for 15, 20 years. I'm like, how? And,
Yeah.
moving around isn't just for your mental stability.
Right.
Moving
Yeah.
around is financially almost, you have to.
Yeah.
Like in order to get a raise that is significant, you have to like almost bounce around.
Yeah.
Because you're stuck in this spot financially where they're going to pay you $32 an hour, but you really like it there. But the hospital down the street is paying $4 more. You have to make that transition. So I feel like you're always having to kind of switch around what you're doing, not only mentally, but financially, all that.
Yeah. No, I agree. I didn't get my first like real raise until I switched departments. Like going from cardiac to ER. They offered me more money and I was so confused because I was like, but I want to go here.
Yeah.
I'm like,
What do you mean?
you're paying me more money to do what I want? This is awesome. Like, I didn't realize it was like that.
And it was weird because like when I transitioned from med surg to ICU, there was no pay increase.
What?
Yeah.
I
So,
can't believe that.
like I was telling you earlier, I'm very like kind of content essentially with like the personal lifestyle I gained from the job I have now. But it is true at some point, if I wanted a significant raise for what I do, which I think I should earn more to do, I would have to go somewhere else.
Yeah.
Because not even the jump from med surg to ICU is a pay increase.
right.
So you just have to wait for that yearly after your evaluation,
yeah.
whether
before you
it's
can go
60 or
somewhere.
80 cents or whatever it is.
Yeah.
So it's like, yeah, you really have to, as a nurse, you can kind of just stay and hang out, but you're not going to see.
Yeah. Yeah. You have to really like it or just be so,
Content.
yeah, like have a good work-life balance. Like, and that's what I tell people. I'm like, if that meets all of your needs, then it's great.
Yeah.
But I feel for the majority, it doesn't. It's
Oh, no.
most of my friends are we're all in a constant pickle and job crisis of, well, what do we do now? And,
No,
we don't know
literally,
where to
like
go.
every nurse I talk to is like, I hate my job and I'm looking for something else, but I don't want to make transition for either schedule purposes, money purposes, whatever it is. Everyone I talk to is like, I want to do something else.
Yeah.
And it's like-
Everyone's looking for
And
like,
it's
a way
oh my
out.
God, am I going to feel like that forever?
Right. I know.
Yeah.
Hopefully not. I don't know.
I think we'll find where we're meant to be.
yeah.
I think
I
we
agree.
explore. I think our personalities, at least, we explore enough to land in a new place that might be fitting.
Yeah.
We'll see. We'll see how it goes.
I know. It is crazy to think about though, because
Yeah.
I'm like, I never think about anymore. I really don't think about like an end goal because I think it's so hard.
Yeah,
Because
I
I'm
don't know what I
like-
want to do next year.
Right. I'm like, I just want to get through like another year
Yeah,
and see where I am, like see what opportunities like aren't presented to me. So it's so hard to like think that far now.
It is.
But yeah, we'll get there.
Yeah. So I have another question I'd like to ask, and I wanted to see if you could go back in time, what you would say to your baby nurse self.
I would say, I would tell myself to probably give myself more grace, and it's not going to be perfect. You know, I have a very type A OCD mentality, and I think I always strive for perfection, but I'm really hard on myself. And, you know, in the instance where I had that really rough 3 days at a travel assignment, I was beating myself up, you know, not giving myself grace at all. But had that happened to my best friend, I would have the best advice in the world. You know, I'd be like, oh my gosh, it's just a job. It's okay. Keep going, you know? So I think I'm really tough on myself, and I don't give myself enough grace for everything I've done so far. You know, and, you know, just all the difficult situations as a nurse that we go through. You know, I feel like I never give myself like the credit that I feel like I should.
Yeah.
You know,
I think we're all kind of our own worst critics, and it is hard to like give yourself a pat on the back.
Yeah.
It's like we only see the like dumb things we say or like the mess ups or all of that.
Right. Like the really small, minor things. And we're like, oh my gosh, like I'm such an idiot.
Yeah. Yeah.
Instead of like, oh, I just saved their life. Go me.
Yeah.
You know, it's like I can't even say that about to myself at the end of it, you know? So yeah, I would probably just say, you know, give myself more grace, and that it's not always going to be perfect. And like, we all make mistakes, you know, and everything happens. And yeah.
I think we could all take that advice.
Yeah.
Okay, another thing I wanted to ask is if someone were coming to you and saying, you know, I'm really thinking about becoming a nurse, what would you say?
Ooh. I would say to stay open-minded in what you want to do. You know, I think when we all start nursing, we have that like tunnel vision, like this is what I'm going for and what I'm doing. The percent of nurses that actually follow that are very low.
Very.
I praise the ones that do. I'm like, that was where you were supposed to go. You know, I have a friend, he became an ICU nurse, went directly to CRNA school, never did anything else. I don't even know how long he was an ICU nurse, but I don't think it was an extremely long time. I was like, that was your path, you know? But I think majority of us, you know, it like goes different ways, and we just never, you know, we all enter thinking we're going to do this. This is what I want to be, what I want to do. But I think especially when you're a new grad, that kind of can shift a little because you're not given every opportunity you think, you know, so you kind of have to just learn, like, that is kind of how nursing is, you know, in the beginning, take what you can get, just gain the experience, you know, and stay open-minded to that versus like, I have to do this first, you know. I had friends when I was first started nursing, since I just transitioned on the cardiac unit, I took my NCLEX on a Thursday morning, found out Friday morning I passed, started working as a nurse on Monday.
Yeah.
There was no time in between because they just were like, yeah, as soon as you are done, like just start. And so I just started orientation Monday morning and like already was a nurse. And part of me wishes I at least would have taken a small break because I just jumped right in.
Mentally, you probably needed, like, after all that studying and the, you know, anxiety of taking the NCLEX and blah, blah, blah. And you're like, okay, I get 2 days and orientation is very scary.
Oh my gosh.
Oh my God. The whole time you're just like, what am I doing?
Yeah. So I felt like, okay, I maybe should have given myself like at least like another week to just breathe. But I'm glad I started because I had friends that were just so adamant on getting the like specialty they wanted. I was off orientation before they got jobs. And I was
Yeah.
like, see, I'm already gaining this experience. You know, it may not be where I thought I was going to be, but I'm learning. I'm a nurse now, you know, and
Absolutely.
you're just having to start. And, you know, if that's important to you to do that path, then I guess you have to. But I try to tell people, like, just get your first job, get in the door, get
Absolutely.
your experience, because, you know, I just reached what month are we in? June. So yeah, last month was my 6 years of being a nurse, and that's, you know, amazing. You
Yeah,
know,
it
had I
is.
waited 5 months to get the perfect specialty I wanted, I still wouldn't be a nurse for 6 years
Oh
for
yeah,
a
absolutely.
couple more months.
Yeah.
So yeah, I would just say be open-minded. You know, I feel like you never know where you're actually gonna
It's so true. I
be.
had a, the group of people that I went to school with, and we were all pretty close, and every single one of us, every single one was like L&D, NICU, all these things. And we were like, this is what we're going to do. Not a single one of us got it.
Oh my gosh.
Because there wasn't, everyone
Yeah.
wants to do those things. And I look back now, and unfortunately, I was kind of forced into med surg. I didn't want to do med surg. Who wants to do med surg, right?
Yeah.
But that was really the only job that I was offered as a brand new nurse, knowing nothing.
Yeah.
So I took it, and I look back and I'm like, I wouldn't be half the nurse I am today if I didn't start in med surg.
Honestly, yeah.
I think everyone should. I mean, I know we can't make that rule, but
yeah, it's controversial.
yeah, it is. It is. But
Some people are very like, you don't have to. And I think it kind of helps you build respect for, because a lot of new grads start in med surg. It's just, they do. And so I feel like when everyone starts there, it's a level of like respect is like, you did that job too, you know?
think
Yeah.
like a good 6 months at least is just like everyone should have to pay their dues.
I agree.
But
I agree.
And
it teaches you so much. Like,
it does. Every day you learn something new.
Yeah.
Every single day, because you cover everything. So the chances of you seeing something that's new is almost like 100%.
Yeah.
It's crazy.
And like the time management, like there is nothing like time management when you have 6 patients. Like you figure it out. Yeah. And 6 or 7 patients.
When you're
nuts.
Yeah, of course in ICU, they're on ventilators, they're on pressors, they're all on all of these things.
Right.
That are stressful. But the time management is so much easier.
Yeah.
You have 2 patients, you do your meds in the morning, you do your full assessment, blah, blah, blah. The rest of the day is, unless of course something happens, your day is very scheduled out. You know exactly what time you're going to do this and that.
Yeah.
On the med surg floor, you're winging it every second of every day.
Yeah. Everyone's awake and needing something.
Yeah. So I just think
at
that
all times,
all around knowledge is beneficial.
Yeah.
But I like what you said. Keep an open mind, because most of us have to.
Yeah.
You have to start that way.
Yeah. And I feel like you'll stay that way when you realize, like, I don't know, like if you're just not finding, kind of like how we are. I think, wait, how long have you been a nurse?
4
4
years.
So we're like similar.
Yeah.
Yeah. And I feel like you reach this point where you're then like, what do we want to do?
Yeah. Like I've done the good stuff.
Every conversation I have with my friends now, which 2 of my really good friends, they left and traveled as well. And then we all kind of came back. One took a staff position at my first ER, and she worked there too.
Mm-hmm.
Now she's back and she's like, like, I don't want to do this again,
Yeah.
And so things like that, it's just like we're all kind of talking all the time, like, what are we going to do? And, the options are kind of endless.
A blessing and a curse.
Yeah.
All right. Well, thank you so much for coming today. I had such a good time talking to you.
I did
You're such an
too.
easy person to talk to.
Oh, so are you. I know. We could talk forever.
I know. I can't wait to see where your career goes. And thank you so much for coming.
Yeah. Thanks for having me.
Yeah. Bye, guys. See you in the next episode.
Bye.